Hello everyone, my name is Daniel Prasad, and today I will be presenting on behalf of my group, including Awiya, Jacqueline, and Vanessa. We will be discussing the role of interprofessional collaboration in chronic disease management. The first thing we have to discuss is what is interprofessional collaboration. In our world today, basic healthcare requires health professionals to work together for the patient to accomplish a desired outcome. But because healthcare involves so many different aspects, providers need to do more than treat a disease as required. Interprofessional collaboration provides patient-centered care that recognizes interdependence across professions, promotes mutual respect, builds relationships, collaborations, and communication. This provides a more holistic method to care, which is optimal for improved patient health outcomes. When explaining the concept of interprofessional collaboration, it is important to understand that it is the practice of approaching patient care from a team-based perspective. There is a significant amount of research to show that patient outcomes, the quality of care, and the cost of care delivery are all optimized when various healthcare disciplines work together towards a shared goal that focuses on the patient. A point of emphasis to take away from this is to note that when we refocus our work through a lens of interprofessionalism, we can help reduce inefficiencies, and this means that ultimately, assessments and treatments are done together, and the focus is on the patient as a whole rather than a specific diagnosis or treatment. Health professionals recognize the interprofessional collaborative approach and how it enhances mutual respect. When looking at the figure on the right, it represents an integrative approach to describing the competencies required for effective interprofessional collaboration. The 6 competencies highlight the knowledge, skills, attitudes, and values that come together to shape judgments that are essential for interprofessional collaborative practice. The set of competencies in this framework reflect a dynamic organization of components that allows practitioners to learn and apply the competencies no matter their level of skill or the type of practice setting they are in. There are 5 key components to interprofessional collaboration. Number 1 is responsibility, and this is the obligation to perform duties, tasks, or roles using sound professional judgment. Number 2 is accountability, and that is about taking responsibility for your actions, always ensuring you are competent to do the activity you've been asked to perform, and always putting patients' interests first. Coordination involves organizing patient care activities and sharing information among all of the participants to achieve safer and more effective care. Communication is defined as exchanging information, thoughts, or ideas using speech, writing, or some other medium such as signals or behaviors. Lastly is mutual trust and respect, and this is to affirm that everyone is treated in a dignified manner at all times and must outline principles of behavior related to professionalism. A practical example to show how interprofessional collaboration has affected chronic disease management is with the use of interprofessional collaborative cardiac rehabilitation programs. How these real-life programs work, which is illustrated by the picture shown, is when an individual is diagnosed with heart disease at a hospital, that patient would not only be referred to a cardiologist, they would be referred to an interprofessional program. This program would have a case manager who coordinates the patient working with a dietitian or a social worker if needed, and a dedicated exercise program working with 1 or 2 professionals weekly for the duration of 6 months. A specific program in practice right now that is incorporating interprofessional collaborative cardiac rehabilitation programs is Rouge Valley Health System Centenary Hospital. As a result of this program, we have seen three major things that have occurred. The first one being a major decrease by 30% in the 5-year mortality in people with coronary artery disease. This benefit is mediated by the several factors that the program has to offer, including the physiological benefits of exercise training, along with the psychological benefits of counseling from health professionals, and because of this, there has also been a decrease in the readmission rates, and the risk of a subsequent cardiac events happening in the future has been decreased in those patients. Dr. Joseph Ricci is the chief of the cardiac care program at Rouge Valley Health System, and he explains that since we have started implementing this program to patient care, the quality of life for them has significantly improved. From implementing the Interprofessional Collaborative Cardiac Rehabilitation Program, the Ministry of Health is saving $100 million per year in Ontario compared to the previous uniprofessional cardiology approach that was being used. Eligible patients for cardiac rehab who did not complete the program cost the healthcare system $8 per day, which is equivalent to $3,000 lost per year when compared with patients who were not referred, did not show up, or who dropped out of the program. Lastly is that the Interprofessional Cardiac Rehabilitation Program has increased patient satisfaction. This is because patients feel like they are taken care of better and they are more confident in this system than the previous one. This new program will reach an additional 680 patients per year, or a total of 1,980 residents in their communities. The figure on the right shows all the benefits patients have seen once they started implementing the cardiac rehabilitation program into their life. Since the launch of the program at Rouge Valley Health System, patients have seen an improvement in their blood pressure, their overall level of fitness, smoking cessation, and quality of life. Chronic disease management for adults requires interprofessional collaboration across different health organizations and sectors. Chronic obstructive pulmonary disease, or COPD, requires thorough care to help manage the condition. The image in the slide represents all the professionals that are needed to properly take care of a patient suffering with emphysema. Now, emphysema is a lung condition that causes shortness of breath and falls within the term COPD. All of these professionals working together have set roles and responsibilities in order to work and achieve a common goal of delivering personalized care for patients. Health professionals working together do a much better job in promoting chronic disease management strategies for diabetes than any one person could. People living with diabetes can lower their risk for microvascular complications such as eye disease and kidney disease. Chronic disease management utilizes collaboration between community-based primary care providers, which involve a pharmacist and dietitian in implementing treatment algorithms, as well as a podiatrist who helps to reduce lower extremity amputation rates in diabetes patients. Interprofessional collaboration strategies for patients with heart failure are associated with a 43% reduction in the total number of heart failure hospitalizations when compared to a uniprofessional approach to care. Psychologists and social workers can help patients to cope with the effects of heart failure in their daily life. By working together, psychologists can help doctors and nurses specifically identify symptoms of depression in patients with heart failure at an early stage before it gets worse over time. The rapidly increasing population living with dementia presents an issue for patients and health professionals to provide an integrated care approach to managing illness. Primary care physicians often lack the time, the support, and the training to systematically screen for and treat dementia. Interprofessional collaboration allows for an occupational therapist and pharmacist to work alongside the physician to provide proper medications and monitor functional performance for the patient. Bariatric surgery is a type of weight loss surgery patients can take, and it is a tool patients can use to help manage their obesity. Chronic disease management for obesity is challenging for the patient, and if they are not suitable for surgery, they will be assessed by multiple professionals, including a bariatric surgeon, a nurse practitioner, and a registered dietitian. All the professionals work together on the care team to restore function through clinical expertise, environmental and equipment modification, through establishing a partnership with the patient before and after their weight loss surgery. Developing a care plan is a recommendation showing how teams can better use interprofessional collaboration in chronic disease management. This chart shown on the right is an example of a shared care plan in chronic disease care. The first element is the current state, which refers to the patient's individual situation and provides the healthcare team with essential background information such as meaningful activities the patient likes to do. The second is goals and concerns, and this process begins and ends with healthcare professionals helping patients to explore and tell their own story, including their experience with illness and health. The third element calls for actions and interventions, which is the actual plan involved to accomplish the goals. And lastly is evaluation, which is where the patient's own outcomes are evaluated, focusing on the three dimensions of importance, personal performance, and satisfaction within care. Interprofessional care teams have been proven to produce positive results, professional satisfaction, and improved patient outcomes. Team care for chronic disease management involves a number of professionals and may also involve multiple practices and a community agency. When looking at the image of the chronic care model, the outcome is that the patient's needs are being addressed through effective communication regarding physical health conditions, mental health, financial aid, and support. Depending on the illness, different collaborative plans are made by the team with the patient. Outcomes are improved because patients exhibit better adherence to treatment. Patients also receive more individualized effective care and team support, which increases goal attainment. We will now be taking a look at a case study about Molly, who is a 66-year-old woman that has been living with type 2 diabetes for 17 years. Molly has an active social life and insists that she is capable of administering her own insulin. This case study will show how a team of healthcare professionals can better use interprofessional collaboration to manage Molly's chronic disease of diabetes. After Molly was found unconscious in her home, she was taken to the hospital by ambulance. Her diagnosis at the hospital was that she had hypoglycemia, which is low blood sugar. After Molly received treatment and underwent other tests to rule out anything more serious, her team reviewed her current situation and determined she was not adhering to treatment and proper diet, and they understood that new recommendations had to be made to use better interprofessional collaboration to help her manage her diabetes. One of the recommendations was that Molly meet with the dietitian to create a diet plan that is easy and manageable while collaborating with her social worker to suggest support groups to better manage her chronic disease. The ophthalmologist will start making appointments with Molly every 6 months to better manage her eye health. and the podiatrist wants to see Molly for a yearly visit to check for nerve damage and restricted blood flow to critical parts of the body. In addition, both the endocrinologist and pharmacist will be seeing Molly every 2 weeks to ensure that she has the right medications to control her diabetes. By team members making follow-up appointments to evaluate Molly more frequently, they are now adjusting her care plan as needed so that she feels more in charge of her chronic disease. To conclude, we have discussed what interprofessional collaboration is, looked at it through a practical perspective in healthcare, and explained what chronic disease management is and how it is incorporated in interprofessional collaboration. And we have also utilized the case study showing the viewers how teams can better use interprofessional collaboration to improve chronic disease management. Thank you for watching.